Communication, public. Amy.
The first person that we have signed in is Max Rockwell.
Matt, before you start, I got to read something. While the law does not require council to provide time for public comment, we historically invite the public to make comment, and we appreciate your input. This is the time when residents and others can comment on matters that concern them. However, if we will not engage in any debate, and as President Council, I reserve the right to end any public comment that is disruptive, embarrassing, harassing, or otherwise objectionable. We ask that you come to the podium, speak into the mic, give your name and address, and we'll allot you 3 minutes.
Thank you. Hello, members of the council. For those of you who I haven't met yet, I'm a second-year medical student at NEOMED down the road, but I am living in Kent. Myself and a few other medical students have come out today to discuss an issue that's significantly intertwined with our profession, and that is health insurance. We are members of Students for a National Health Program, and while our local chapter was founded just last year, we have 114 members supporting our cause. Many of our members joined SNaHP because through our work in the healthcare field, we've discovered an unfortunate truth. The system is broken. Currently, the U.S. spends more money on our healthcare system than other countries with universal coverage, and this number has actually been increasing in the past few years. Despite this, the worker and employee contribution has been significantly increasing as well. Sadly, even though we are spending more compared to similar countries, our healthcare system is ranked 11 out of 11, last place. The U.S. has the highest, or has the lowest life expectancy of these countries, the highest infant mortality rate, and the highest maternal mortality rate. And that maternal mortality rate has actually been increasing in recent years, whereas in every other one of these countries, it's been going down, which is highly concerning. All of this leads to delayed care and worse health outcomes for our patients. I would like to share a personal experience with you. Before I started medical school, I was working in a skin cancer clinic in Columbus, mostly dealing with melanoma and metastatic skin cancers. Skin cancer is the most common cancer in the United States, but it's unique in that it's one of the most treatable too. If identified early, it can be surgically excised, and this is often curative. However, we don't have any shortage of patients. Far too often, I would hear stories of people who come in and they've delayed care until their disease had spread, citing concerns of high cost of care. And it's a fair concern to have. While doctors should be able to focus on providing care to their patients, unfortunately, a lot of the conversations we have revolve around finance. Initial conversations often involve patients hesitantly asking us, like, how much is this treatment actually going to cost me? And unfortunately, the response is sobering. For melanoma, our response is, and I quote, "Without insurance, about the cost of a small, nice home." You can imagine, this leaves patients distraught and facing huge financial burdens, potentially bankruptcy if they're uninsured. For far too long, patients have struggled with paying for medications, treatment, and preventative care. This is why we are urging the Kent City Council to pass a resolution supporting S4204, the Medicare For All Act of 2022. We recognize this is a complex issue, and we would love to discuss the specifics at greater length. If we are able to present briefly at the next subcommittee meeting in October to explain our stance further, we would be happy to do so. We've also provided some materials in your packets today that will go over some of the policy highlights as well as issues with our current system, and we have included a copy of our resolution as well. I'd also like to let the council know that all the students present here today have a really big exam coming up Friday that we all need to study for, but this was something that they just felt so strongly about that they decided to take time away from studying to come out and show their support of this. So if students are ducking out after their comments, they're just heading back to study. So I just wanted to address that. But yeah, I would like to thank the council for their time, and we hope you will add this issue to the agenda for the next subcommittee meeting in October. Thank you.
Okay, thank you. Next.
Michael Massey.
Michael, 3 minutes to give your name and address for the record.
Perfect, yes. Hello, members of the City Council. I'm also a second-year medical student like Max. and I wanted to share a quick story about why I became such a staunch supporter of Medicare for All as a medical student. A few years ago, I was shadowing a physician in Columbus, Ohio on the night shift, where I met a patient who would change my outlook on medicine going forward forever. The patient was a woman in her late 30s, and when I entered her room at 3 a.m., she was crying and contorting on her hospital bed. As it turns out, she was diagnosed with early onset multiple sclerosis, or MS, as a teenager. Unfortunately for her, her family never had insurance growing up. Even when I met her, she did not have insurance, even as her husband worked 2 jobs and she worked from home making phone calls. I bring up her lack of insurance because all effective medications for MS cost over $70,000 per year. She could never afford the treatment. Because of that, as the doctor told me, her MS ravaged her nervous system multiple decades before it would have with the medication. So she was actually immobilized to a wheelchair because of the pain of her condition as a young mother of 2. You may be thinking why this patient was in the hospital at all if she knew that she couldn't afford her treatment. Well, she was actually in the hospital because her motorized wheelchair had malfunctioned and careened her into a vending machine, shattering both of her knees. I can still picture her grimacing through tears, telling me and the physician that she needed to get out of the hospital as soon as possible because she knew that stay there would bankrupt her family. This story does not happen in a vacuum. I can tell you that I've seen dozens of similar experiences or similar cases in my clinical experience since then, and we know that 26 million Americans are uninsured in this country and millions more are underinsured with sky-high deductibles. Medical debt is also the highest cause of bankruptcy in the U.S. I support Medicare for All because these stories would no longer exist under Medicare for All, and it would not exist in my profession. Medicare for All, according to over 24 studies, would save billions of dollars per year while saving an estimated 45,000 to 68,000 lives of Americans who die on average because of a lack of access to health insurance. And this plan would also cover full medical, dental, vision, hearing, mental, and long-term health coverage to everyone in the country without any out-of-pocket expenses except for a $200 cap on prescription drugs. I'll defer to our handout and any questions for more details on the financial and health benefits. I just want to say that last week the Kent Board of Health passed a resolution urging the City Council to take action on this issue. We implore you to introduce our resolution for Medicare for All. If it is passed here, the Kent City Council will join over 100 cities, 5 states, and 15 national medical societies in calling upon Congress to support Medicare for All. Thank you.
Thank you. Do you have any information our clerk can have? I know you brought yours.
They sent it to me.
All right, I just want to make sure everybody's on the same bucket. Next.
Lauren Genko.
Name and address, and we'll give you 3 minutes, young lady.
I'm also a resident of Kent and a second-year medical student at NEOMED. I'm here to advocate for Medicare for All, a single-payer, universal healthcare system to service all who live in America because it would be right for Kent. Over the past 60 years, 58 other countries established similar systems and pay half of what the U.S. pays for healthcare. Why can't we in the U.S. do the same? Think about it. Rigorous scientific studies show that with Medicare for All, we can make healthcare right for all of our people while saving billions of taxpayers' dollars and saving countless lives. As the richest nation in the world, we should have Medicare for All because, 1, it's right for our communities. It would include all medications, dental, vision, long-term care, mental health, and addiction treatment with no copays or deductibles or other hidden charges. We could stop worrying that a single illness or accident will bankrupt us. 2, it's right for our businesses. Medicare for All unties healthcare from employment. Workers are free to change jobs or start their own businesses. It means no extra medical liabilities for workers' comp or property insurances. It will make America globally competitive once again. And 3, finally, it's right for Kent. Under Medicare for All, public agencies such as the City of Kent would save significant amounts of money due to decreased cost of health insurance for its employees. There has never been an easier decision for the City Council to make. It's time for us to demand Medicare for All because it's the right thing to do for our families, our businesses, and especially for our city. Thank you for your time.
Thank you. Further?
Rehan Asif.
Name and address, and we'll give you 3 minutes, sir.
So I support this resolution endorsing the Medicare for All bill. because universal health care is the most practical and fair method of providing care to people of any socioeconomic status. I actually grew up in an upper middle class family where my father was luckily earning enough to be able to pay for all of our health expenses. But around and after the Great Recession in 2007, he had trouble finding a job, working at different places, even around the country. His top priority was to get us quality health care, but oftentimes the private insurance that came from his employer was limited and had issues with what they would cover, especially in terms of dental and vision care. In the years that my father was unemployed I was able to get the best health coverage of my life through the state Medicaid program. I got glasses as I was unable to otherwise read the boards in school, which impacted my performance. And I also had braces to correct an impacted tooth that I had, which almost every private insurance company deemed as cosmetic, even though it can cause nerve damage to the area and is also at higher risk of getting infected. When I was on my father's company's insurances, I had numerous instances where the insurance company flat out refused to pay, and we had to pay out of pocket. For my family, the out-of-pocket costs were inconvenient but manageable, and I was able to have a favorable health outcome. Others are not so lucky to have a financial cushion for medical costs. To me, universal health care represents stability, efficiency, quality, and equity, ideals which we should all aspire to achieve in society. Thank you.
Thank you. Next, Amy.
James Moore.
Name and address. We'll give you 3 minutes, James.
Good evening, members of the City Council, Mayor, everyone in the audience who's listening. I'm a long-term resident of Kent, and in 2017 I became the 3rd generation in my family to graduate from Kent State University. Now I'm the 1st generation in my family to earn a medical doctorate over at NEOMED. But before that, right out of college, I worked all over our county as a behavioral health case manager at Coleman Health Services. And I bring all this up because I have seen firsthand how the disparities and the inefficiencies in our current health system affect the lives of our local citizens. As a case manager, I spent literally dozens and dozens of hours sitting down at Jobs and Family Services and in my own office, helping struggling people to fill out paperwork to sign up for Medicaid, to sign up for Medicare, and also to deal with problems with the supposedly good private health insurance plans that a minority of my clients had that universally refused to cover any costs related to case management services. When clients weren't covered by pre-existing Medicaid coverage, though, someone had to eat that cost, and that someone was the county. It was sometimes the organization itself, and sometimes it was the city of Kent directly. To put the scale of that issue into perspective, according to recent numbers from Data USA, 18.1% of Kent residents currently rely on Medicaid as their primary health coverage. If, God willing, my clients stabilized enough to find gainful employment and begin to rise themselves out of poverty, they had the prospect of getting kicked off their medical insurance and having to navigate the marketplace alongside premiums, deductibles, copays, coinsurance, and worst of all, health providers whose hands are tied by the stringent prior authorization requirements that for-profit insurance companies use to buffer their margins. As someone who is dedicating their career to medicine, this system is maddening. Our people deserve better, and right now, as leaders of our city government, you have an opportunity to add our community to a growing number of cities in Ohio that are taking a stand to demand something better. A system, hopefully, like those that every other highly developed nation in the world has been able to achieve before us. So I'd like to just end by pointing out that the authors of Medicare, as we know it, originally intended for it to begin as a program for the elderly and then to expand its coverage to all citizens once the infrastructure was in place. That obviously did not happen, at least not yet, and that's because special interests killed that vision, some of whom ashamedly were part of my profession. This is obviously an uphill battle, but it is one that will eventually be won. I believe it will happen in my lifetime, but it is up to the people, city by city, taking every opportunity that we have to make the push to complete the unfinished business that was started when President Johnson signed Medicare into law in 1965. It's 2022 now, and passing local resolutions like the one that is being presented to you today is a critical step in realizing that goal. And with that, I'd like to thank you for your time and attention.
Thank you.
Ms. Diane Smith?
Unfinished business. Any unfinished business? New business? Heidi?
Yes, I would like to make a motion to put the topic of the resolution to endorse Medicare for All into committee. I believe that would be the Health and Safety Committee.
Second.
Second. Further discussion? Heidi?
Yeah, I mean, these individuals in front of us are amazingly well-spoken on this issue. I find that I'm so happy that they have taken up this cause. They see that what they're getting into is a profession where there are inequalities of right. And I, as a grant writer, the grants that I write are often for the underinsured. And do you know who those underinsured are? The people with private insurance. So this is something that I think for us to join the rest of the civilized world, in essence, we need to really take this up, work through it. And it starts at the local level. This is interesting how these initiatives really do come from the bottom up. So I would like to get the opportunity to educate ourselves a little further on this issue and discuss whether we want to go along with our health department in supporting the resolution.
Tracy?
It just seems like the logical next step. It's a win-win-win for everything. It saves money, it helps people. Let's do it.
Any other discussion? Roger?
Yeah, well, our speakers, they were wonderful tonight. While they were talking, I was on my phone looking up something. You know, we've spent so far $8.2 billion with another $12 billion in the pipeline to support Ukraine, which I'm totally, approve of. But when you think about that, that's $20 billion, and yet the argument against Medicare for All is how we're going to pay for it. And quite candidly, I've said that. I can remember being in a large conversation one time in a school related meeting about health costs and everything, and I actually said, I wonder how we would pay for a Medicare for All. And the reality is when we put our minds to it, we come up with the money in this country. And I think that it's more of an issue of people thinking that it moves us away from a capitalist society into a socialist society. But the reality is the only way we can have a strong capitalist society if we have healthy people who can work and who can produce and do those things. And so it just makes good sense to me to follow the lead of our health department under Joan's leadership and consider this, and maybe we need some more information in a committee.
Robin, do you have your hand up?
Yeah. Of course, we're all aware of my situation. If it were not for the expansion of Medicaid by a Republican governor in the state of Ohio, I wouldn't be alive. This is more than about dollars and cents. This is about the ability for people to have an opportunity when they get sick and they're in dire circumstances to be able to gain access to what should be a right in this country, that we end up competing against one another, those who have health care and their fear that other people are going to get something for free that we should all be getting, and not worrying about so much the individual doctor that I have to maintain. I have to maintain this cost and this, that, and the other. There are those of us who battle every day to stay alive and who choose not to go to a doctor because they don't want to become bankrupt. I'm right there. I think about that every day, about paying my utilities, about getting sued, because I can't. They look at you as a council person, they think somehow you've got something. Well, I'm the poor council. I struggle all the time. And it's difficult. It's difficult to bring it up, to let people know that you're struggling. It's tough. If we create a greater opportunity for people to have access so that they don't have to embarrass themselves by going and having people ask questions that sometimes demean you, or you feel demeaned, because pride goeth before a great fall. And we can do better than this. We should be doing better than this. It's huge. What you young people are doing is so meaningful and so important to those people who are out there today who just are trying to see how to get through to the next day. It's tough. So thank you. We'll take it up. And I think I'll be proud to be able to make a motion in support for your bill. Thank you.
Jack?
Yeah, I just want to thank you all for the valuable information. And I guess the only comment I have is I don't think it's for the United States of America to be finishing last in many of these areas, not acceptable. Thank you.
Any further comments? All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Is there further new business?